Good morning and welcome to the 34th meeting of the Health, Social Care and Sport Committee in 2024. I've received no apologies for this meeting. The first item on our agenda is to agree to take agenda item 4, in private. Are members agreed? Thank you. The next item on our agenda is an opportunity for members to put questions to the Minister for Social Care, Mental Wellbeing and Sport in relation to the National Care Service Scotland Bill. And I welcome to the committee Marie Todd, Minister for Social Care, Mental Wellbeing and Sport, Donna Bell, Director of Social Care and National Care Service Development, John Paul Liddle, Deputy Director for National Care Service Development and Delivery, and Lucy McMichael, Senior Lawyer, Scottish Government. I'd like to invite the Minister to make a short opening statement.
Good morning. I'd like to thank the committee for its consideration of the NCS bill. It remains critical that we get this right. Strong social care and community health support are the bedrock of a thriving, compassionate civil society. Given the many areas we agree on, I appeal to members across the political spectrum to engage collaboratively on this endeavour. I'd also like to thank the many organisations and individuals who responded to the committee's call for evidence. The overwhelming majority of respondents recognise the status quo cannot continue and fundamental change is required. This echoes the thousands of conversations my officials and I have had with people across Scotland who use social care and community health services and people with caring responsibilities. In these discussions, people have told us three key issues required urgent action: shifting society's attitude to ensure social care is properly valued, access to consistent, high-quality support and services targeted where and when they are most needed, with clear information about availability. There is an unacceptable variation across local authorities, and oversight of planning and delivery. This committee's post-legislative scrutiny of the Self-Directed Support Act has itself highlighted the importance of this. Here we have the furthest to go to reassure people with lived experience they've been heard and we're taking action. The bill is intended to address all three issues with structural reform that further empowers the role of people with lived experience. The bill and draft amendments that I sent in June represents how best to achieve this reform. As you're aware, while some draft amendments have garnered broad support, we have encountered opposition to other proposals. I can answer questions about the Government's policy intention behind those proposed amendments if helpful, as they're part of the consensus we're working on. I need to consider what approach will secure sufficient support to progress. For these reasons, on the 13th of November, I wrote to the committee and I said I wanted to take time to fully reflect the views expressed in our approach, that I was not seeking to start stage 2 today. This was a necessary step to ensure that we get this right. We need to come together, agree the way forward and deliver for people who need it most, those who use or work in social care and community health services and those with caring responsibilities. It's vital the needs and voices of people with lived experience are put first. We must together work together to develop a social care system that we can be proud of.
Thank you very much, Minister, and we'll move straight to questions. And Sandesh Gohani.
Thank you. A declaration of interest as a practising NHS GP. Good morning, Minister. Minister, are you responsible for and in charge of the NCS, or is there somebody else in government we should be speaking to?
So, as you're aware, I am a junior minister with responsibility for those things in my portfolio, and I work as part of a team of health ministers, and we work as part of a cabinet structure within government.
So are you in charge of the NCS, Minister?
Yes.
Okay. And Minister, in your statement to Parliament and on BBC Drive Time comments on the 14th of November, given that statement and the things that you've said, have you been entirely and wholly truthful on what occurred between the Scottish Government and COSLA?
Yes.
Okay. Minister, the forecast cost from Scottish Government is up to £1.3 billion over 5 years. How much of this will be an increase for frontline services?
So that statement's incorrect. The forecast cost of the National Care Service as refined is £345 million over 10 years.
And how much of that would be an increase in frontline servicing?
So there has been significant increase in frontline investment over this term of Parliament. We had an ambition to increase investment by a quarter, and we have achieved that earlier than expected. I would expect, with the rising ageing demographic, that our frontline costs will increase over the next 5 years.
Okay.
That's, I mean, I guess in actual fact, the financial memorandum is about the cost of the bill, not about the cost of social care. At the moment, we spend £5.75 billion per year on social care.
Absolutely, Minister. So that money is for the cost of the bill, not going directly into frontline services?
345 million, but I mean, that does cover some frontline services.
Okay. And here in Parliament, 4 different committees have criticised and, in some cases, rejected the National Care Service plan, and yet you continue to push it forward, putting taxpayer £30 million in the cost, and the social care workforce who rely on the care at risk. Why did you continue to push it when all these committees were telling you there were real issues going on?
So what we did when the bill was introduced, there was a number of committees and stakeholders, committees in this Parliament, opposition parties and stakeholders who raised concerns about the bill. That's why we paused and refined. We worked very hard to strike an agreement with COSLA and the National Care Service, which we did last June, on the tripartite shared accountability arrangements. And from last June, we've worked together on that point. The amendments that I sent to this committee this June were draft amendments that were intended to bring that to life in legislation.
Okay. And so you touched upon the amendments that were sent across. So about 46 amendments, I think it was. And that really did completely change the bill as was originally drafted. Yet we went through stage 1 and then retook evidence. Now, what you have said to us is you don't want to continue with stage 2 just yet. You're going to take time to listen. But the letter seemed to indicate that you are removing part 1 of the bill. Does that mean that we need to start again for consideration of whatever proposal the government put forward again for the NCS?
So I don't think so, no. I think that it's very well established that there's a great deal that we agree on within the bill. What I need to do is hear from opposition parties, stakeholders, which parts of the bill they are in agreement with and which parts need refinement. And I am in that process at the moment of listening and reflecting on what I'm hearing and making decisions on how to move forward. What is clear, and you'll have heard this in evidence within this committee, what is very clear from people who access social care, from people whose loved ones depend on social care, is that the status quo is not acceptable. That currently many people are telling us the social care system in Scotland is broken and there needs to be fundamental systemic change in order to deliver better social care. So I'll be keen to hear from all political parties in this Parliament how we proceed.
Thank you.
Emma Harper.
Thanks, Convener. Good morning to you, Minister and officials. It was just to pick up on what you said about the variation in care across Scotland. And I know that we've got certain local authorities that are one local authority, one health board, and then there's others that are the health board will have then up 3 local authorities working with them. So in terms of health and social care integration and the variation that you're describing, for instance, delayed discharge, isn't that part of why the service needs reform, why we need our people who provide care but people who also access care? They're asking for change, and the variation is one aspect of it.
Absolutely. So that's one of the most crucial things that people are asking us for. They are unhappy with the postcode lottery that they face at the moment, so that people in one part of the country have one type of social care system and access to certain services in another part of the country completely different. The delayed discharges, I mean, the focus on delayed discharges, it's not because it's the most important thing about social care, but to me it is indicative. So it's like a tip of an iceberg showing a dysfunctional system. And the social care, the delayed discharge numbers vary by a factor of 10 across the country. So the worst area in Scotland is 10 times as high in terms of level of delayed discharges as the best area in Scotland. I think that's an unacceptable level of variation for our citizens to have to tolerate. I agree with them that that needs to change.
Okay, thanks. And I know we're going to come on to integration later, so I'll pause there. Thank you.
Thank you. Paul Sweeney.
Thank you, Convener. Thank you, Minister. During our Stage 2 scrutiny of the bill, it was clear from numerous stakeholders that there was an immediate need to pursue concurrent reforms, even notwithstanding the passage of the bill. So, to that extent, what scope of measures are you considering to address immediate concerns in relation to a number of factors that were brought up by stakeholders? These include the recruitment and retention of staff, ensuring consistency and equity in how social care is delivered, the complex governance landscape of integration, unmet need and weights for assessments, and the right to break for carers.
So you're absolutely correct. I've personally spoken to hundreds of people during this bill process who are accessing social care. The team have heard from thousands of people, and people are telling us loudly and clearly that the system is not working at present. We have increased investment. So, as I said, we set ourselves a target of increasing investment. So many would say that the fundamental challenge is a lack of investment. I wouldn't disagree that social care needs more money. However, we have put in $1 billion extra in the last few years, and we haven't seen the systemic improvement that we would expect from that investment. That indicates, and Feely looked very closely at the system. What he said was the system very clearly needs reform. It is not simply a case of investing, pumping additional money into a system that needs reform. We've got a whole suite of work going on, so we have a lot of work going on to try and improve the conditions for social care workers. We've worked very closely and are close to delivering a system of collective bargaining. We have a lot of work going on to attract people into social care careers, to support them with development in CPD within their careers. And we have a whole range of efforts in terms of tackling, we have I think I described it in the Chamber last week, we have a CRAG meeting weekly in which government and local systems come together to look particularly at the issues of delayed discharges and try to work out how to tackle both delayed discharges and unmet need, and what can be done to improve efficiency within the system, to try to pick up on the areas where there is best practice occurring. This is one of the things that's really difficult for local systems, is to pick up on best practice in other parts of the country and to translate it into their local system. There is no one size fits all. They have to adapt and use apply the methodology that's been used in parts of the country where it's working well to their area of the country. I've said this before to this committee, I live in the rural West Highlands. It's very clear to me there's no one size fits all, but certainly a national care service would enable us to better pick up best practice and share it around the country and ensure that our entire system was working as well as it possibly can, despite the strains.
You highlight that financial resourcing alone isn't the solution, and that other metrics have to be considered. You've outlined some examples. To what extent are you considering legislative amendments? So, for example, the Public Bodies Act of 2014, the Social Care Self-Directed Support Act of 2013 and the Carers Act of 2016. Are these mechanisms that you could look to amend to give effect to some of the goals that have been highlighted by stakeholders in terms of addressing problems in the system?
So I'll perhaps ask my officials to chip in, but that is fundamentally what some of the National Care Service Bill is doing. It is amending those pieces of legislation to deliver the changes that people have told us through the Feely review that they want to see.
I suppose what I'm asking is, are you trying to do this discreetly rather than as a single move? Clearly that's not carried support with key stakeholders, but could you consider taking forward certain actions through amendment of existing legislation?
So that does look like an attractive option. I can understand that you're pursuing that. The reason that we pursued the National Care Service Bill is because we feel there requires wholesale, structural, fundamental reform. And we think it is wise to bring all these things together into one piece of legislation that this Parliament scrutinises in one go. There are some things that we can only do with primary legislation. So, for example, a very crucial part of the National Care Service as proposed, and one that everybody supports, is the information sharing. That requires primary legislation. So you could perhaps pursue each of the goals of the Feely review on an individual basis, and you could probably, by regulation, achieve some of them, but there are some things you just can't do that require primary legislation.
Okay. If it's, I don't know if any of your colleagues wanted to come in on that.
Either of you want to come in?
No, I think you've answered
Fair
all
enough.
of that. Thank you.
Clearly there's a problem with garnering support with trade unions, with local authorities, and indeed in Parliament itself. Is this a possible way to break through that impasse by actually highlighting where there are opportunities to implement reforms incrementally using existing legislation, and then highlighting where there are clear needs for a discrete piece of overarching legislation that could come in later? Clearly, trade unions expressed a view that action is needed in the social care sector now, and perhaps their support would be more likely if there were actions taken more immediately in certain respects.
So I work very closely with the trade unions. Many of the comments they have made don't actually relate to this legislation. They're comments on social care in general, and their view is absolutely valid. They're raising concerns about the social care system, but not raising concerns about the legislation, if I could be clear about that. I think it's really important that I listen to all of the parliamentary parties in this Parliament and work out what there is support for. What I am hearing at the moment is that there is strong support for a number of aspects of this bill. And in fact, I'm not even hearing much concern being raised about amendments. So the areas where there is very clear consensus would be things like complex care commissioning, Anne's Law, information sharing, support for unpaid carers. There's strong support for that. The issues that the trade unions are asking for, which are outside legislation, so they're not part of the NCS bill, things like the collective bargaining, sectoral bargaining, we're making real progress on that. We're very close to the point of that being a reality. In fact, the legislation that Stephen Kinnock has introduced in the UK government, in the UK Parliament, is probably more relevant for that. And I'm in negotiation at the moment with the UK government about how we can consider that legislation applying in some way to Scotland, particularly given the work that we have already done. We're well ahead of the UK government in terms of the work we've done to put fair work principles into social care in Scotland. So I'm keen to collaborate with the UK government on that piece of work, but that would be a separate piece of legislation from the NCS.
Would the Minister, just in conclusion, would the Minister be able to furnish the committee with an outline of where the government sees an opportunity to make progress regardless of the bill at the moment? So you highlighted collective bargaining, perhaps other areas like right to breaks, Anne's Law, ethical commissioning, National Social Work Agency could be progressed without the NCS bill per se, whereas you've highlighted certain areas which would require it, such as information sharing. Is there an opportunity for the government to actually furnish the committee with those discrete elements which they think could be carried forward under existing legislation, and ones that are absolutely critical on the NCS bill progressing?
Yeah, absolutely. I mean, I guess that's what part of this discussion is about this morning, is to make sure that committee members on this committee understand that there are some things that we can do by different means. There are subtle differences in how we achieve that. If we take Anne's Law, for example, the care home relatives were initially very keen on the idea of primary legislation. And one of the reasons for the wish for primary legislation is that it can't be changed so easily. So were we to face another pandemic, it would require a level of scrutiny from this Parliament in order to change that primary legislation, which changing secondary regulations wouldn't require, wouldn't attract the same level of scrutiny. So there are definitely different ways of achieving the same thing. I need to spend some time listening to stakeholders, listening to political parties in this Parliament and finding a way forward, navigating a way forward through that. I think it's really important that I work very closely with stakeholders, and I'm very content to come back to you with a clearer idea and a proposal. I've said in my letter when I asked for a pause, I said I'd like to set out in the new year what I think is the next steps are likely to be.
Okay, thank you.
Joe Fitzpatrick.
Minister, going back to Paul's initial part of his question, he was asking about the immediate challenges and pressures and financial pressures that social care is currently facing. So obviously one of the big things that's happened recently is the UK government's decision to raise employers' national insurance contributions and not to exempt the social care sector. So I wonder if you could talk a little bit about the impact of that decision.
So we had the debate in Parliament last week, which was about the entirety of the impact of that decision on our public services. The impact on social care, social care is delivered slightly differently in Scotland from England. That decision was made without any detailed examination of how social care is delivered in Scotland. That decision was made without consultation with stakeholders and without modelling, as far as I understand, of the consequences of that decision. The decision to raise employers' national insurance was made because the Labour Party had boxed themselves in during the run-up to the general election and had left themselves little option for raising extra funding, which in this Parliament we're all agreed is required for our public services. The impact on social care, I would go so far as to say it could be catastrophic. So we think it's around a cost of around 84 million per year to the social care sector. Much of social care is delivered by private companies and by not-for-profit companies. They have no way of increasing the amount of money that they take in. Most businesses can increase their charges to cover those extra national insurance costs. That is very difficult for our social care sector to increase their charges and cover those extra costs. And at a time, I think the not-for-profit sector, for example, they think and they don't think this is the entirety, but their initial sort of rough calculations was 21 million annual cost for that increase. It's just inconceivable that they can find that extra money easily next year. Now, the places that I am most concerned about, and you'll all have heard about the challenges faced in certain parts of the country in terms of market failure. So, for example, in Highland, I think you heard evidence from Fiona Davis that over the last 2 years there's been a loss of 200 care home beds in NHS Highland area. So the system is extremely precarious there already. We have market failure in Highland already. This added pressure, I believe, could be catastrophic for our system, and I am really anxious about the impact that it may have.
Thanks very much. Can I very quickly, so you mentioned 21 million and 84 million pounds, so that's per year, so it's not something like can be filled from reserves and then move on. It's every year.
This will be every year. This is a permanent change to employers' national insurance contribution, and social care will be hit particularly hard because of the number of part-time employees in it, and there are lots of low-paid and part-time employees, so a particular hard hit from that change.
Thank you.
Thanks. David Torrance.
Thank you, Convener. The Minister, how would you respond to criticism that the committee has heard from many stakeholders that the Expert Legislative Advisory Group had very limited input to the formation of the Scottish Government's Stage 2 amendments of the bill?
So I'll maybe bring Donna Bell in here, who was very close to that, the ELAG group. The ELAG group was brought into being largely because of the Parliament suggesting during the course of stage 1 that we needed to put together that group. We were already in a process of hearing a great deal and listening to stakeholders a great deal. We heard, I think there was more than 70
at times, yes,
organisations involved in that ELEG. So I guess given the complexity of social care and given the number of different stakeholders involved, it is very likely that no single stakeholder was likely to see their view reflected in the legislation. But each of them were heard. It was developed with their collaboration. And we worked really hard to make sure we brought to life what people were telling us. I don't know if there's more you want to say.
The group met very regularly and was very well attended. We covered all of the themes that were later brought forward as amendments. And I think there was really honest and open debate there for over a number of weeks. And that really allowed people to give us their views. I think, as Ms Todd's already said, it was quite tricky to reflect individual views. And indeed, in some cases, there were conflicts in the views that were offered. But I think overall it was a successful process. And I mean, JP John Paul chaired that group quite a number of times. And I think, well, you might want to say a wee bit about it, actually, John Paul.
Yeah, I suppose just to echo what Donna and the Minister have said, the size of the group and the diversity of views that were expressed meant that we weren't aiming for consensus in that group of people. That wouldn't really have been a realistic goal from that discussion, but it was an opportunity for people to hear each other's points of view and to make sure that we'd heard all of that sort of rich discussion to inform the draft amendments that were shared with the committee in June.
What is the current status of the group, and if it exists, what do you expect its future role in the National Care Service?
So it's not meeting at the moment. We could revive it. I have a number of stakeholder groups that I do meet with regularly. So I've got the Social Covenant Steering Group and the Key Stakeholder Steering Group, who I meet with and have done throughout the development of this legislation. I meet with them very regularly. In fact, I'm meeting with them today after this committee appearance. The Expert Legislative Advisory Group is a much broader group, focused particularly on the drafting of the legislation. We could bring them back together in future if we felt that was a useful thing to do, or if Parliament feels it's a useful thing for us to do.
No further questions?
Thank you. Brian Whittle.
Thank you, Vera. Good morning, Ministers and your officials. Can I ask questions around the accountability of the National Care Service? I think it's fair to say there's a pretty strong divergence in views about where that accountability should lie. And you mentioned, obviously around about the postcode lottery, which I do recognise very much in my own area. We look at Ayrshire, three councils, one health board, and a significant variance among the three of them. So, how would you, in terms of the accountability, how would you address the need to overcome that sort of postcode lottery, but also recognising that local government will still have responsibility for delivering the service?
So, you're absolutely correct. There is an unacceptable level of variation, and we often use Ayrshire as the illustration for that unacceptable level of variation. So, as you say, one health board, 3 local authority areas, East Ayrshire, a very low level of delayed discharges. And again, it's not that delayed discharge is the be-all and end-all, but it is the tip of the iceberg. So East Ayrshire, fairly low level of delayed discharges. North Ayrshire, more than double that. South Ayrshire, more than 3 times what is happening in East Ayrshire. So there are different levels of priority, spend, grip, assurance in each of those systems. And there are challenges. I mean, there are demographic differences that might be contributing to some of that difference. So you're probably not going to get uniformity across the country, even if there is a national system. What we're hearing loudly and clearly is that there is some support with recognising the situation as it stands and improving and picking up on learning nationally. So, for example, in Ayrshire, South Ayrshire, I think it was, I spoke to recently, they've started a frailty service within their hospital that is having a huge impact on the efficiency of their system. Really effective piece of work. Now we need to quickly learn about that and translate it out throughout the country, because it's really having an almost immediate impact, and we have very little in the way of mechanisms for doing that. I think it was Henry McLeish who said to me, and who does a lot of work for Alzheimer's Scotland, he said, you know, I can visit an area of Scotland where there is absolutely amazing work going on, and I ask, how do we get this happening in the other 31 local authority areas? And, for example, the charity or third sector organisation delivering that amazing piece of work has to go and persuade the other 31 local authorities to do the same thing. So there needs to be a mechanism to pick up on great work nationally and make sure it works. When we first made the shared accountability agreement, what we agreed was that operational responsibility, statutory responsibility, delivery would absolutely remain with local authorities. I've said and reiterated many times, I believe that's really important. I come from the rural West Highlands. What works in my part of the country will not work in Edinburgh, will not work in Fife. It is really important that the social care, the delivery of social care, can take into account the local challenges and the local assets that are available in every community. What isn't, there is undoubtedly, though, a necessary variation, and that shared accountability meant that instead of, so the bill as originally introduced meant that ministers had sole responsibility for social care in Scotland. At the moment, it sits with local authorities. And what we said was we'll share that. Local authorities, NHS and ministers will share that accountability. And together, we will make sure that there is top-notch local delivery and national oversight, which, you know, when this committee looked at self-directed support, one of the things that they were very clear was required was national oversight. And that's what we agreed on. That's what we have been working on, meeting weekly with local authority colleagues in COSLA since June last year in order to deliver. And we had agreed, I would say, 90 to 95% of what was required to deliver that. And as I set out in the Chamber last week, around June this year, local authorities came to government and said, we have capacity challenges in facing the delayed discharge crisis and continuing negotiation over the National Care Service Bill. Can you take that off the table temporarily so that we can focus on delayed discharges? So we did that. We paused negotiations, and without coming back to the negotiation table, local authorities withdrew their support from the shared accountability agreement. Now, that's why I was setting out in Parliament. I was so disappointed with how that happened. I believe that we should have come back round the table and worked on the remaining very small percentage of areas where we disagreed. But that's not where we are. They have withdrawn support. In terms of accountability, I mean, I think you've heard in your evidence sessions that the disabled people's organisations say we have given far too much power and responsibility to our local authorities. And the local authorities say very clearly we are trying to take too much power away from them. I think the fact that we have those polar opposite views is just the reality of the situation that we are in at the moment. And we have to strike a balance between those polar opposite views on accountability being entirely the responsibility of the local systems, democratically accountable to their local population, but with no national oversight, and national oversight, but no difference in local delivery. I think we have to find a balance in the middle. And I thought we had found that. That's why I'm frustrated and disappointed with what's occurred.
Thank you. Just as an aside, I think Ayrshire is a very interesting example of this, and I would have thought that I happened to meet with the Chief Exec on Friday and asked her the very question why there was such a divergence locally. I just wonder whether or not you've done the same, maybe, and that would have been quite. I thought that's quite enlightening.
Yeah, I mean, as I said, we meet weekly with local systems, so we meet with everyone across the country every week. The Cabinet has visited Ayrshire recently and met with system leaders and had quite detailed discussions about some of the challenges that they face. Some of the areas which are facing particularly difficult challenges we meet with very regularly to try to drill down into what the explanation is for that local variation. I have, as part of my ministerial role, I have very regular meetings with Highland Systems, for example, to look at why their delayed discharge rate is quite so high compared to the rest of the country. And there are some reasons for it. You know, things like rurality has an impact, things like poverty has an impact, but there is undoubtedly a level of variation that isn't explainable only by those factors. If you look at, for example, our Highland and our Gyle and Bute, the challenges that are faced in Highland with delivery of social care, so the geography, topography, the sparse population, the labour market shortages, the competition with hospitality for a labour market, all of those things also apply in our Gyle and Bute, where they're not facing the same challenge with delayed discharges.
Okay, thank you. Can I ask around the... So the Public Bodies and Joint Working Scotland Act 2014 was really around trying to integrate health and social care. I think it would be fair to say that whatever changes you make within social care will have a significant impact on the delivery of health in general. So why a national care service being the right model is the right model and not a national health and care service?
I think a national care service was what was recommended in the Feely Review. The Feely Review, I suppose, came from the experience during the pandemic, where the impact of the pandemic on social care delivery around Scotland was felt very strongly by people who are accessing social care. I mean, the impact is still being felt. So the Feely Review was an independent review of what had happened during the pandemic, but looked broader than that. And it was Feely who recommended a national care service. I think there is no getting away from the fact that health and social care need to be integrated, and that we need to think of it as an integrated whole system when we're thinking of all of the challenges facing both health and social care. So if we think about, for example, the 4-hour A&E target, which is a health target, that's reflective. It's a canary in the mine target. It reflects the whole system. It tells you how healthy things are in primary care and how healthy things are in social care in terms of how easy it is for the patients to flow through the hospital. So they are a whole system. You can't separate the two. And it's vitally important that we conceive of it that way.
Okay, just a small one to just looking. Are you still committed to the creation of a National Care Service Board, and how will that be constructed?
So I haven't made decisions yet. As I said, I'm hearing from political parties around this Parliament, listening very carefully to what I think we can legislate on. I think it's really important that we have national oversight, though, of what is happening in social care in Scotland. And I think we've heard that loud and clear throughout the process of developing the legislative proposals for a National Care Service Bill.
Thank you, Convener.
Emma Harper.
Thanks, Convener. Just to follow on Brian Whittle's questions, and I'm hearing about what you're describing in the variation in Ayrshire, with East Ayrshire, North Ayrshire, South Ayrshire, and obviously something needs to change in addressing the variation of care. And I'm interested in exploring what would you like to see to take forward in terms of integration joint board changes, for instance, and what would you like to see as an outcome as we go forward?
So I guess, what the government thought would give effect, give deliver the change that we need to see was the legislative proposals that we've brought forward. I think in terms of how the IJBs operate, I think it is clear that there are challenges in terms of the different cohorts that are represented in the IJBs. And we need to provide support and training to ensure that they are able to act as a whole, as well as representing their individual constituencies. Say. So when a local councillor is on an IJB, they are not simply representing the council's view, they are representing the citizens as well, for example. And I think we could give more support and help to enable that. One thing that I am absolutely determined would bring better focus, better grip, better assurance, better scrutiny to the local system is if people with lived experience had a seat at that table and an equal seat at that table. So I think people with lived experience need to have representation at local level and they need to have representation at national level. And Philly was clear that that was one of the main ways that we would deliver a human rights-based approach in social care, was making sure that people with lived experience had a voice at the table at local and national level. I think there are challenges. I mean, I hear very clearly from representatives of carers and representatives of users that there is a power imbalance around the table. But I think there are things that we could do to support people to ensure that they were able to represent users effectively and lived experience effectively. I think there are supports that we could put in to make sure that that worked really well and that would deliver a level of grip and assurance that isn't there at the moment.
Mm-hmm. And the people with lived experience are asking for things like, I don't want to have to repeat my story multiple times, and the aspect that you were describing earlier in the fact that the primary legislation is required in order to support better information sharing or safe information sharing, and so that people with lived experience aren't going to be re-traumatised if they're being asked again and again to share their story. Is that part of why we need this primary National Care Service legislation?
So absolutely. So that is an absolutely crucial part of the legislation that can only be delivered by primary legislation, is the data sharing potential. And you're quite right. People regularly tell us how traumatising it is to have to tell their story time and time again. You'll have heard evidence from people who have a variety of different carers with health and social care hats on, and those systems who come into their house every day, and those systems don't appear to talk to each other. So we absolutely need to do better. It would make the system significantly more efficient, free up a lot of time at the coalface, and it would be a lot kinder to the people who are accessing social care, because they wouldn't have to tell everyone the things that are important about them time and time again. They would just do it once.
Okay, and just a final question. It's about the proposals to make the delegation of children's services and justice and social work services all part of the legislation going forward. How are you taking that forward? That would be the easiest question.
So there were, I guess, 3 areas of disagreement at the time that we paused negotiations with COSLA, and that was direct funding, removal of people from boards, and the issue of children and justice. And that had been contentious throughout, and we were continuing discussion about it. I've been very clear that I think it would be the best thing if children's services and justice services were within the National Care Service. I think that is important from an individual who is accessing care's perspective. I think that gives you the most cohesive, joined-up experience. If you think about children being taken into care in Scotland, very often those children are vulnerable and are taken into care in Scotland because of issues that are making their parents vulnerable, and their parents have either adult social care support or justice social care support. So I think it's really important that we look at how this system works better for vulnerable citizens in Scotland. And I think that integration of the whole system, so if we recognise that children live in families, live in communities, and that it is not, usually a factor relating to it's not usually the child that is requiring care because of their own situation. It is usually because of the family situation. I think the social work profession has been very clear to us that they would like the profession to stay together under one umbrella as well, so that's something to bear in mind. But obviously that issue has been very contentious with local authority partners who believe that decision around whether services are delegated or not should be a local decision.
Okay, thank you.
I don't know if any of you want to add any more to that, or have I explained it adequately?
No, I think you've explained it very well.
Okay, thanks.
Thanks. So, Minister, you'll be aware that this committee's Stage 1 report called for greater clarity concerning the scope and purpose of the co-design process, and for Parliament to be regularly updated about progress and outcomes. Can you provide an update on what Scottish Government is doing to address that recommendation?
I don't want me to take that'd be great.
Yeah, so obviously we have provided updates to Parliament over the course of the co-design process, and we've throughout said that co-design will be an ongoing process because that is the nature of the way that we intend to build the National Care Service. So we published a number of reports from the co-design work last year on keeping care support local, information sharing, making sure my voice is heard, realising rights and responsibilities and valuing the workforce. We have followed up on each of those, and we have done some specific work on the National Care Service Charter and also on the Workforce Charter. Quite a significant amount of work has gone into co-design of the complaints process as well. All of those have been published on our web pages, so we're very happy to share those again with the committee if that would be a helpful thing to do. We do have that kind of ongoing process of co-design with the lived experience expert panel and with the wider stakeholder groups that we engage with. So we can provide an update on the very specific things that we've published or a more general update on the engagement that we're undertaking.
Thank you. Ms Bell, can I ask about the co-design work on the Charter? How will that be completed and implemented, and is that work ongoing while the bill has been paused?
Yeah, I mean, I can start, and John Paul might want to come in, but yeah, we're on the second iteration of the Charter at the moment, and that is available to committee members and to the wider public. I do think that will be an iterative process, so we have a version that is in use at the moment, but I think what we've been very clear with people about is that needs to be an iterative process, and if things change, we should be absolutely open to that change. So again, very happy to reshare that with the committee and provide regular updates if that would be a helpful thing to do.
I think that would be helpful. Carol Mohan.
Convener, thank you. I have a question around the social work agency, as many of us have had, stakeholders approaching us about that, and then perhaps a more general one if you don't mind. So I suppose really, is it the intention to move forward with a national social work agency? I think everyone agrees we don't need legislation for that, but people are keen to know, and whether that would be social work or that wider healthcare professional group.
Yes, you're absolutely correct. We are still committed to establishing a national social work agency. There is general consensus that would be a good thing, and that stemmed from a recommendation from the original Feely report. We think that that is what is required for the social work profession to drive. They don't have the same level of professional oversight as some of our other professions working in health and social care and representation, and we think that that will help to drive change and continuous improvement and provide support. I mean, I think you'll all be aware of the number of newly qualified social workers who leave the profession, so we want to provide a good supportive environment so that people can be supported to become effective professionals and progress through the course of their working life into specialist areas if that's what's required. I think the reason that Feely picked out the social work profession particularly is because they do have a particular role within legislation. I always describe the social work profession as being absolutely crucial in terms of upholding human rights within the system. And of course, if we want to achieve a rights-based approach to social care in Scotland, it's really vital that the social work profession are supported and enabled to fulfil their duties according to law in terms of upholding human rights within the system. And I think that's why there's a particular focus on social workers. That's not to say that there is no focus whatsoever on social care workers. Everyone within the system is really important. And, if I go back to the scale of challenge that is being faced by the social care system, by the change in employers' contribution to national insurance, and just how many people that might translate into no longer working in the system, it is really concerning. Everyone who works in social care is really important. I'm well aware that there are professions like occupational therapists who work within the same sort of areas as social workers do, and we're working with their professional body to make sure that they are well represented in the decisions that we're making. I do, however, think that it is important that social workers have their own professional body, and that profession, that we as parliamentarians recognise how crucial that profession is to the delivery of human rights-based social care in Scotland.
Okay. Thank you. I think people will find that answer quite helpful because we do get asked that. I suppose in a more general sense, if you don't mind me asking, I've been listening really carefully to the points that you've been making and your role in your leadership role, I suppose, as the Minister for the National Care Service. And I'm interested to know, in terms of the way in which you place your recommendations to Cabinet, to Government, do you emphasise either way that you think we should stick to trying to get agreement around the National Care Service, or are you giving some advice around we should be moving forward with 3 or 4 of the things we know we can do now? Do you give any balance to that when you speak to your colleagues as the leader in this area?
So my main focus is on outcomes. My main focus is on what do we need to achieve for the people of Scotland. And I have heard loud and clear that the system, as we are currently overseeing it and delivering social care in Scotland, is broken, and that we need to fundamentally change the way that we deliver. I think it's part of my role as Minister to ensure that the voice of lived experience is heard loud and clear. I have been very dismayed at how that hasn't always been heard within the discussion around social care. We have some very strong institutions involved in delivering local care, social care, and the people who are actually accessing social care are often not heard within that. So I hold my relationship with them very precious, and I absolutely, when I make representations to Cabinet, talk about how the decisions that we make will impact on them and what their wishes are within the system, what outcomes they want to see. They tell me very clearly they want a human rights-based approach. They want to tackle the variation around the country. and they want a system of social care that protects their dignity and supports them and has early intervention and prevention before they reach crisis. And when things aren't going well, they want a clear system to put in complaints or concerns and have those concerns investigated and upheld.
And just one last, in all that,
I'm a junior minister. I'm very happy to take the guidance and wisdom of all of my senior colleagues. I mean, this is what happens with collective responsibility. We have a great deal of experience around the cabinet table and within our government, and I listen very carefully to how they think that we can deliver the improvement that we need to see, in the same way as I listen to all of you as parliamentarians.
I mean, I do accept that what you said there is what the outcome that you're looking for. I suppose my question is, do you think, in terms of this Parliament at this point in time, that you should be representing, doing some of the things that we can do now quickly, and would that benefit that whole group that you talked about there that you want to get outcomes for?
So I'll absolutely, Carol, be looking for allies who will work with me on the things that we agree on.
Okay.
And there is a great deal that we agree on. And I'll be looking for allies across this Parliament who will help me to progress and see the changes that we all want to see. I very rarely hear from parliamentarians in this place that they want things to stay the same. I think everybody acknowledges that the system needs fundamental change. So we need to work together on what that change is going to be.
Thank you.
Thank you. Elena Witt.
Thanks, Convener, and good morning, Minister. I want to explore some issues around about the Fair Work agenda. We've already touched on some of that already this morning, but I would like to go into a little bit more detail. Stakeholders have advised that a definition for ethical commissioning should be discussed and agreed, and they've emphasised that that's a critical in delivering the Fair Work agenda. We've also heard from yourself this morning, which I think is quite helpful, around about the sectoral bargaining issues that you've been discussing with your UK counterpart. So it might be good to get a little bit more information round about that. And we've also heard the pressures that are going to be on the system with regards to that £21 million that's estimated in the third sector. So with that in mind, we know that there's good examples around about collaborative commissioning and procuring arrangements such as the Granite Care Consortium and the Fife Care Collaborative. How do you intend to further facilitate and accelerate more ethical commissioning models and improved procurement practices, bearing in mind those new pressures that are perhaps going to put some spanners in the works?
So you're absolutely correct, and you're correct to pick out the examples of really good practice that we have within Scotland. As I said, one of the challenges we have with our social care system in Scotland is that there are some areas where things are brilliant, things are happening. Granite Care and Fife Care Collaborative would be exemplars for ethical commissioning and procurement, but picking up on them and making sure that happens that way all over the country is a challenge. Through the ethical commissioning and ethical procurement, Fair Work principles will be embedded in social care tenders and contracts where we can manage to do that in a non-discriminatory, proportionate and relevant to the subject matter of the contract. So there's some tricky issues of law to navigate, but we are able to do it. I think in terms of, I don't know if at the very start of your question you mentioned the ethical commissioning and the definition. I think there's been some concern from people examining the legislation that the profile of ethical commissioning had slipped, and that certainly there's been no policy change from us. We are absolutely committed to ethical commissioning and procurement. If there have been drafting issues where bits have moved from legislation or are lower profile within the legislation, we are more than happy to take your guidance and put them back in and make sure they have prominence within the legislation. We know at the moment there's a big implementation gap between the commissioning intent and the actual delivery of social care for people. There's an inconsistency of approach within different areas, and the views of people with lived experience aren't always heard. So we established the Adult Social Care Ethical Commissioning Working Group to look at improvements to the current commissioning process in partnership with COSLA, because ministers, frankly, aren't responsible for commissioning and procurement of social care. It's local government who are. So they are considering existing good practice, the examples of collaborative commissioning that we have within Scotland. They're also looking at what the barriers to ethical commissioning might be. So, as you say, there is the national insurance hike, employers' national insurance hike in contribution may well be a spanner in the works. So they're looking closely at what the barriers are and the financial considerations. It has looked very closely at those local examples. I suppose I would caveat by saying that there is no one size fits all, so we can't pick up I hear great things about Granite Care, but we can't make things work exactly like that in every part of the country. But the way they are working is certainly something to be examined and picked up on and learned from.
One other wee question, you touched on it yourself, Minister, before about the workers within the sector, many of them being part-time workers. A lot of them are also women. Mm-hmm. So just to explore a little bit about how we're going to make sure that this workforce are going to have their lot improved as far as we can possibly do that. If we're not proceeding at this stage with the National Care Service, in the meantime, how can we actually protect that workforce as much as we can, given the precariousness that we're now seeing, the added pressure about that national insurance change?
So I think you're absolutely correct. There are real challenges. There are some structural reasons why the social care workforce is disempowered compared to other workforces. Firstly, caring is not generally valued in society. That's not my view, but care is regarded as a drain on society rather than an investment in society globally. We need to shift that narrative. It is a largely female workforce, so I think it's over 80% female workforce. And we know that women, even, near 50 years after the equal pay legislation, we're not equally paid in society. It's also largely ununionised. So I think it's less than 20% of the workforce is unionised. It's about 19% of the workforce is unionised. The workers who are unionised are largely working for local authorities. So the private social care workers tend not to be unionised. And I think many of us around this table would have concerns about that and would recognise that unionisation would be a way to strengthen the workforce's hand and to ensure that they were empowered and recognised within the system. And I regularly talk to unions about that. I say, I'm not sure if you think I'm an unusual sort of government minister, but I would be far more comfortable if this workforce were more unionised. In lieu of that, so I can't introduce unionisation to the workforce, I can work with the unions to take away some of the barriers, but we are working very carefully on the sectoral bargaining. We think it's very close to being ready. We think that will deliver an improvement in pay and in conditions for the sector. That's been really, really challenging to deliver. And in fact, the unions were very helpful to us in recommending academics who could help us to unlock some of the barriers. The challenge is that there are over 1,000 different employers, and we in government are not part of the negotiation. But I think we have managed to make really substantial progress, so I'm very pleased about that. We need to try and give effective voice to the workers. So that's, when I talk about lived experience, I suppose I should make it clear that I talk about lived experience being the people who are accessing social care, so people who are using social care, their carers and the people whose loved ones are accessing social care, and the people who are working in social care. That to me are the voices of lived experience. They need to have representation. And my idea for the National Care Service Board would be that people working in social care would have had representation in that board as well. So I think there are things that we can do. I do think the work with the legislation that they've introduced in the UK, so many of the barriers in progressing fair work in Scotland are because we don't have employment law is reserved, so we don't have the power to tackle many of these issues. And that's why we get round it with our procurement and commissioning. I think that we have a different government in the UK. I think that the legislation that they've introduced is very interesting. I think we're significantly further ahead in Scotland in terms of delivering fair work within social care, and I'm keen to work with them. Of course, I want them to devolve the powers to the Scottish Government because I believe we're much further on, and I think the social care situation in Scotland is sufficiently different from England to warrant that. But we'll work together however we can to make sure that we make a difference to the people working in social care. I guess the other thing that we do regularly is talk up social care. I'm not sure how much difference that makes, but I see social care as a massive investment in society. I've talked before, I think, at this committee, like when we were having a national forum in the Glasgow Science Centre, and on the wall there's a quote from Stephen Hawking, a man who made an incredible contribution to our understanding globally of the world that we live in, and the universe that we live in fact. Now, that man would not have been able to make that contribution if he didn't have social care. So social care is absolutely vital to the individuals who are accessing social care. It is absolutely vital to their families, it is vital to our communities, and it is vital to our society. It makes a profound difference to our society, and we all need to be saying that loudly and clearly as often as possible.
Thank you.
Gillian Mackay.
Thanks, Convener. Good morning, Minister. We've touched on some of Anne's Law already, but during the evidence we took around the Stage 2 amendments, we heard from some of those who support Anne's Law that they were frustrated at the lack of progress before the legislation comes in to achieving the aims of Anne's Law. I wonder if you share that frustration of those families, and what work's ongoing to give life to the practicalities of Anne's Law before it is actually put on the statute book.
Yeah, so I meet very regularly with the care home relatives representatives, and in fact just last week myself and the First Minister had a meeting with the care home representatives, relatives representatives, and with Campbell Duke, the widower of Anne. As is often the case, we had a very emotional discussion around the circumstances that have led them to plead with government and with Parliament to bring to life Anne's Law. At that meeting, we, myself and the First Minister, absolutely reiterated our commitment to delivering Anne's Law in legislation. Under no circumstances, we assured the families, under no circumstances will we allow the difficulties in legislating for the NCS to mean that we do not legislate for Anne's Law. We will do it. It is really important that we get the legislation right, and that, for that I'm really grateful for their continued input. The reason that the amendments on Anne's Law were held back from the June package that came to committee was because we haven't quite got the legislation right yet, and I have assured them that it won't be right until they think it's right. It's not my opinion that counts, it's their opinion that counts. So on that basis, I am really pleased that Anne's Law has effectively been introduced into the country. We heard Kevin Stewart mention that in the Chamber last week, that he put into strengthened social care standards, health and social care standards for care homes, the spirit of Anne's Law. So people who live in care homes now can name family members or friends to visit them when there are restrictions on routine visiting to prevent infection. They can also name people who directly participate in meeting their care needs. I suppose I go back to the discussion around Anne's Law. The reason that the National Care Service Bill was chosen as the vehicle for Anne's Law is because of the commitment of the entirety of the bill to people's fundamental human rights. And embedding human rights within our social care services. And there are, I would say, more options, more flexibility with primary legislation than with amending secondary regulations. But we won't let the challenges with the National Care Service Bill prevent us from legislating. We will do what they are asking of us.
Do you have a timeline for that at all? Obviously, there's a pause in the bill at the moment, and I'm maybe asking for you to get your crystal ball out here, Minister. But obviously, some of the families are concerned that a pause does mean that full implementation is kicked down the road further. Can you give them some reassurance about the impetus is behind that to get it done and get it over the line?
So, Anne's Law will be implemented as soon as is practically possible. And I think the care home relatives know and understand the challenges that we're facing in balancing. Anne's Law will engage ECHR, and it's always tricky when you're balancing human rights to get the legislation correct. So they understand the complexity and the sensitivity and the challenges involved, and we're working very closely with them to get the balance right on those rights. I assure them that we will deliver Anne's Law. I think we need to take time to get it correct. And my plan is, I said in my letter to this committee that I would come back with a new timetable for the new year. So I don't think they're going to be waiting terribly long. There won't be a long delay, I don't think. The other thing is that once the legislation passes, so there's lots of discussion around how long it would take for the National Care Service to come into being, and there's been quite a lot of headlines within the newspapers around how many years it would take to see it happen. The Anne's Law legislation could be implemented immediately as soon as the Act is given royal assent. So as soon as the bill becomes an Act, we could see pretty rapid implementation from that point on, and we'd be working to deliver it as soon as was reasonably practicable. I'm remembering my government jargon now. As soon as it's reasonably practicable, as soon as the bill becomes an Act, we'd be working hard to deliver it for them. There's no reason to wait.
That's good. Thanks, Camilla.
Thank you. Can I thank the Minister and her officials for their attendance today. You can leave if you wish. Committee's work will continue. The third item on our agenda is consideration of 3 negative instruments. The Delegated Powers and Law Reform Committee considered all 3 instruments at its meeting on the 19th of November 2024 and made no recommendations in relation to these instruments. No motions to annul have been received in relation to the instruments. The first instrument for our consideration today is the Official Controls Import of High-Risk Food and Feed of Non-Animal Origin Amendment Scotland No. 2 Regulations 2024. The instrument amends Commission Implementation Regulation EU 2019/1793, imposing temporary increase of official controls and emergency measures governing the entry into the Union of certain goods from certain third countries. Do members have any comments? Emma Harper.
Thanks, Convener. I do have a comment just in rereading the information. I just think I have no problem with any of the instruments. I just think it's worth highlighting and recognising the work of Food Standards Scotland and Food Standards Agency in reviewing the food products and other products that might come into the country, because in reading about high-risk food and feed, we're thinking about levels of pesticides used in other countries, alpha toxins, mycotoxins, things that are potentially carcinogenic at levels that might not be acceptable. So I think we need to just value the work of Food Standards Scotland and Food Standards Agency for reviewing the products and making sure that what goes into our food system is safe.
Thank you, Ms Harper. That will now be on the official report. I propose that the committee does not make any recommendations in relation to this negative instrument. Does any member disagree with this? No. Thank you. The second instrument for our consideration today is the Food Safety Sampling and Qualifications Scotland Amendment Regulations 2024. The purpose of this instrument is to extend recognition of relevant professional qualifications for food examiners to those issued in Switzerland to comply with the UK-Switzerland Recognition of Professional Qualifications RPQ agreement. Do members have any comments they wish to make? None? Okay. I propose that the committee does not make any recommendations in relation to this negative instrument. Does any member disagree with this? The final instrument is the Feed Additives Authorisations and Uses of Feed Intended for Particular Nutritional Purposes Miscellaneous Amendment Scotland Regulations 2024. This instrument implements the decision made by the Minister for Public Health and Women's Health to authorise 25 feed additives and 1 feed for particular nutritional purposes. Do any members have any comments? I propose that the committee does not make any recommendations in relation to this negative instrument. Does any member disagree? Okay, thank you. Our next meeting will take place on Tuesday the 10th of December, and at that meeting we will be taking evidence from the Minister for Public Health and Women's Health on a package of subordinate legislation on burial law and then on dentistry in Scotland. And this concludes the public part of our meeting today.